All right.
Perfect. Welcome, everyone. If you didn't hear my original welcome, we're glad to have you. We're approaching almost 200 people on this call, so there won't be time for individual questions or stories or anything. The idea of this presentation is so that you can get a lot of information in 2 hours. You will receive the PowerPoint and the recording of this webinar after the meeting. You will all get that. So if you register for the meeting, you will get that information. I also in the chat put the HCA PEBB Medicare email address that you can ask questions there too. You could ask questions here in the chat, but let's make them limited and related to the slides. Maybe you need clarification on something. We don't have time to, answer or talk about personal stories and things right now. So I hope a lot of you participated in the listening sessions that we had a while back. But anyway, we want you to get the most information. And so watch the PowerPoint, listen to the recording again. You have that email address, and we want you to get the information that you need so that you can make the choice, because healthcare is very personal and the plan, no one knows what plan's good for you except for you. So without further ado, I would like to introduce Ellen, and this is her third time that she's come and done a WEA presentation before the open enrollment started. And so she's a senior account manager. Well, you can see it on the screen there. So Ellen, go ahead.
Thank you so much, Mary. I really appreciate the introduction, and I look forward to a very productive session today. The agenda for today is we're going to talk about some assumptions. We'll talk about what risk pools are. We'll talk in pretty much a lot of detail about the Medicare retiree medical options. I will briefly go over some non-Medicare retiree options. We'll talk about some resources, and then my information will be available for questions. And as Mary said, if you have questions in the chat and can reference a slide number, she can interrupt and I'll get you the clarification. The assumptions are that you may already be retired and you're currently in PEBB, or you are thinking about retiring soon and you will be in PEBB. We're not going to go over how to contact DRS for your pension or Social Security for Medicare, but I'm assuming that you know how to meet those requirements. You will be enrolling in one of the PEBB Medicare plans or non-Medicare plans, either as a new retiree or switching or changing your health plan. You know that vision is included in your PEBB medical plan. So any medical plan that you choose has vision coverage. And you know that dental is separate. And one of the things that I want to make note of is that Delta is the administrator for 2 of the dental plans that we have: Delta Care, which is a managed care plan, and Uniform Dental Plan, which is a PPO, preferred provider organization plan. And there's a lot of dental confusion, and I'm mentioning this because I happen to be the account manager for dental as well. And so I deal with a lot of those questions. You can be in the Uniform Dental Plan with any of the medical plans. It does not have to be paired with Uniform Medical Plan. Okay. Let's talk about risk pools. A risk pool is just a way of assessing and balancing the health risks for a given population. So you can create a risk pool with any given population. SEB is rated differently from PEBB, and that's because there tend to be younger people in SEB, and they certainly have more younger dependents. PEBB itself has 2 risk pools. One is for active employees and also includes non-Medicare retirees. Again, non-Medicare retirees tend to be younger than 65. And so they're in the same risk pool as active employees. There's a separate risk pool just for people on Medicare, and it includes Medicare by disability or Medicare by age, which would be age 65. So let's look at how PEBB works with Medicare. First of all, you must be enrolled in Part A and Part B in Medicare to enroll in a PEBB plan. Medicare Part A is basically hospital services, inpatient services. Medicare Part B is basically outpatient services, so seeing primary care or specialists. It also covers infusion therapy and durable medical equipment. You have to pay your Part B premium directly to Medicare. It is separate and in addition to what you pay to HCA as a premium for your health care. If you don't pay your Part B premium, you run the risk of losing your Medicare eligibility. So you must pay your Part B premium. Medicare premiums are based on income. There is something called an IRMAA, I-R-M-A-A. It stands for the Income Related Monthly Adjustment Amount. So if you have excess income as determined by Social Security, which this year it's over $94,000 for an individual or $173,000 for a couple filing taxes jointly. Medicare looks back 2 years at your tax returns, and if you are above that amount, then you pay a small monthly adjustment amount, a separate additional amount. If you are enrolled in a Part D, like David plan, the IRMAA, the income related monthly adjustment amount, applies against your Part B premium and also against Part D. HCA offers different Medicare plan types, and each one works differently with Medicare. So the types of plans that we have include coordination of benefits. Sometimes this is referred to as secondary insurance. So you would have traditional Medicare or fee-for-service Medicare. So it's Part A and Part B. Medicare pays primary on the medical claims, and the plans offer creditable drug coverage. Creditable drug coverage is a term of art, and it means that the coverage is at least as good as Part D, but it is not a Part D plan. And you can think of Part D for drugs, and then it's easy to separate D from B. Coordination of benefits in UMP is our basic plan that people have, that is a coordination of benefits plan. Kaiser Washington also has an original Medicare plan if you don't qualify, if you don't live in their Medicare Advantage area. And those coordinate with Medicare. Medicare Advantage is a slightly different way of handling claims. So Medicare Advantage is sometimes referred to as Medicare Part C, and it's the Medicare Part A and B are included, and the coverage is coordinated by the company, that the carrier that has its contract with CMS, which is the Center for Medicare Services. And the carrier coordinates all of the care. Our plans are employer group waiver plans. They are not commercial plans, and I'll go into some details later on about the difference. Medicare Advantage plans can be either HMOs, a health maintenance organization with a limited region or network, or they can be PPO, preferred provider organization, with a much broader network. They can include either creditable drug coverage or Part D. If Medicare Advantage includes Part D, the plan is called an MAPD.
Speaker.
The third type of plan that we have is a Medicare supplement plan. Medicare supplement plans are sometimes called Medigap plans. These plans are under the jurisdiction of the Office of the Insurance Commissioner, And they are designed specifically to cover the copays, the 20% that traditional Medicare does not cover. And they cover only Medicare covered services, and they offer no drugs coverage at all. So if you take a Medicare supplement plan or a Medigap plan, then you have to purchase a Part D plan from the commercial market. Here are the premiums for 2024. This is reflecting a single subscriber. So generally speaking, if it's you and a spouse and you're both Medicare eligible, you can just times this times 2. It's a monthly amount. There's a slight adjustment. This chart includes the $5.96 charge for the administrative fee. So if 2 people are covered, we only charge 1 administrative fee. So it's slightly different than just multiplying by 2. And there's a different calculation if somebody is not Medicare eligible along with somebody who is Medicare eligible. And I can talk about that in a bit. So you can see these plans are, this is arranged alphabetically. You can see the premiums range from Primera Plan G for age 65 and over is the lowest at $101.99 per month. The highest is UMP Classic Medicare at $532.94 per month. And that has to do with the structure of the plan, and we can talk more about that as well. It is important to note UMP Classic is self-insured. The way that UMP Classic works, Medicare is primary payer for medical claims. The plan then picks up the part that Medicare doesn't cover. But for pharmacy, it is only the plan, only UMP that is paying those claims. There is no other money to subsidize those claims. And that in large part drives why it's so expensive. It's also an incredibly rich plan. It has a lot of benefits. The idea of having the same benefits in a different structure so that it would be cheaper doesn't really exist. The only way to lower the premiums is to either change benefits or change structure. And those ideas are being looked at right now. But currently there is nothing that can affect these premiums going into 2024. This is a very summary overview of some benefit comparisons. So I just want to save space on the slide. I did not include all the plan names, so I want to review them so that everybody knows what I'm talking about. For coordination of benefits, again, it's Kaiser Permanente Washington Original Medicare or UMP Classic Medicare. Those are the 2 plans that we have that do coordination of benefits. For Medicare Advantage, it's important to note that if you see any plan name that has the word Advantage in it, it is a Medicare Advantage plan. And MAPD is an abbreviation for Medicare Advantage plus Part D coverage. And so for Medicare Advantage, Kaiser Northwest has a plan called Senior Advantage, which is a Medicare Advantage plan. Kaiser Washington has a Medicare Advantage plan called Medicare Advantage. For the MAPDs, these are offered by United Healthcare. There are 2 plans, PEBB Balance and PEBB Complete. They are Medicare Advantage plans, and they also include prescription drug coverage through a Part D aspect. For Medicare Supplement, We have Plan G, which is offered by Premera. Again, Medicare supplement is sometimes called Medigap. And Plan F still exists, but it is closed for enrollment, so nobody can enroll anymore in it. So I'm only talking about Plan G. The way that the plan works is exactly the same for Plan F, but with one exception, but I'm really going to limit my discussion to Plan G. So the first line is, are these plans nationwide? So the coordination of benefit plans, both of them are nationwide. The Kaiser Medicare Advantage plans, whether it's Kaiser Northwest or Kaiser Washington, both of those are regional only. They are not nationwide. The MAPD plans, again, those are Medicare Advantage plans that include Part D coverage, and those are nationwide. And the Medigap plan, Plan G, is nationwide. There is a pharmacy deductible that comes into play for the coordination of benefits plans. There is no pharmacy deductible for the KP, either of the KP Medicare Advantage plans. There is a deductible for the United MAPD plans, and I'll go into more specifics about all this. And note that it's listed as NA, not applicable, under Plan G. And the reason for that is to distinguish the fact that it's not that there's no deductible, it's that there's no coverage for drugs at all in Plan G. Glasses, hearing aids, massage, these are just examples of some of the additional benefits. This is not a complete list, this is just a summary. Those are covered under all of the plans except for the Medicare supplement plans. Again, Medicare supplement plans cover just Medicare covered services, and those additional services are not part of Medicare. Gym membership is not covered under the coordination of benefits plans, but under UMP, it is covered under KP Original Medicare. It is covered in the Medicare Advantage plans of all types, and it is not covered under Plan G. I do want to note that Premera offers discount programs for gym memberships. They also offer discount programs on hearing aids and eyeglasses that become available once you enroll in Plan G. And then drug coverage. There's drug coverage in all the plans, except of course, Plan G as a Medicare supplement plan does not have drug coverage. If you choose that plan, you must get a Part D plan through the Health Benefits Exchange off the commercial market. Drug coverage, again, can be either creditable drug coverage, meaning it's at least as good as Part D coverage, or it can actually be Part D, which is only part of the MAPD at this point. This slide is a different kind of summary of some of the most frequently asked about benefits so that you can see sort of plan to plan what the difference is. This doesn't show you everything, and plan comparisons can run pages and pages. It's very difficult to get every little aspect. But I will try to answer questions as much as I can. And I tried to give you an overview here of, again, the most commonly asked about benefits and how the different plans deal with them. So the plans are down the left-hand side. The kinds of benefits are across the top. And you can see that I'm listing cost shares. Cost shares are either co-pays, which means they're a fixed dollar amount, or their co-insurance, which is a percentage of the actual charge. So for hospital stays, UMP Classic Medicare is $200 a day, up to $600 per admission, up to the medical out-of-pocket limit. And there is no charge for professional services for mental health and substance use disorder for UMP Classic Medicare. Mental health and substance use disorder are just covered as regular hospital services for the other plans. Kaiser Original Medicare has a $150 per day charge, up to $750 per admission. Kaiser Northwest Senior Advantage, again, a Medicare Advantage plan, has $500 per admission. Kaiser Washington Medicare Advantage, obviously a Medicare Advantage plan, has $200 a day, up to $1,000 per admission. The United Healthcare PEB Balance, which is an MAPD, again, a Medicare Advantage plan that includes Part D, has a $500 charge per admission. United Healthcare PEB Complete, which is also a Medicare Advantage, including Part D coverage, an MAPD plan, has $0 copays for hospital, and Primera Plan G has $0. You can see that UMP Classic is the only plan that has co-insurance percentage charges. Every other plan has copays. Copays are specific dollar amounts. Primary care is the lows of primary care are either there's no copay at all, or $15 up to $25, and then in UMP Classic Medicare, it's 15% of the copay. I'm sorry, of the charge. Specialists for UMP are also 15% of the charge. For Kaiser Original Medicare, it's $30. For Kaiser Northwest Senior Advantage, it's $35. For Kaiser Washington Medicare Advantage, it's $30. For PEB Balance, it's $30. PEB Complete is $0, and Primera is $0. And the MAPD plans, UMP Classic, do not require a referral for specialists. Some of the Kaiser plans do. You can see the outpatient charges, and then the final column is naturopathy. And I included that because naturopathy is not covered by Medicare. So it's only covered by some of the plans. It's covered by every plan except Primera Plan G. But there are differences in how it is treated. So under UMP Classic, there's a 15% co-insurance, but there are some conditions. So you have to consult the certificate of coverage, the COC, to find out what the specifics are. The Kaiser plans have Kaiser Washington Original Medicare, $15 copay, and you can have 3 visits per medical diagnosis per year. Kaiser Northwest Senior Advantage is a $25 copay. Kaiser Washington Medicare Advantage is $15 copay, 3 visits per medical diagnosis per year. PEB Balance is $30, and PEB Complete is also a $30 copay. On PEB Balance and PEB Complete, so the United Healthcare plans, the way that naturopathy works is almost all naturopaths will not bill United directly. So you have to get a reimbursement, but you get reimbursed at 100% of the billed charges, less any applicable copay. So if you're on PEB Balance, it would be 100% of the bill less the $30. If you're on PEB Complete, it would be 100% of the bill. And there's an online form that United has for reimbursement, and there's an online process for submitting that. In terms of drug benefits, there are real differences in how the plans treat drugs, and we'll go into that more specifically, but this slide is just about the deductible and the maximum out of pocket. For UMP Classic, there's $100 deductible for tier 2 and specialty drugs, but not insulin. And the maximum out of pocket is $2,000. This is just for the pharmacy. For Kaiser Original Medicare, there is no deductible, and the maximum out of pocket is combined with medical for $2,000 total, medical and pharmacy. For Northwest Senior Advantage, there is no deductible. However, there's also no maximum out of pocket, so you have no cap on that. For Kaiser Washington Medicare Advantage, there's also no deductible and no cap on the maximum out of pocket. For PEBB Balance, there's $100 deductible against tiers 2, 3, or 4 only, and a $2,000 maximum out of pocket. And PEBB Complete is the same. It is worth noting that the drug plans for PEBB Balance and PEBB Complete are exactly the same. And also, it's worth noting that insulin is capped at $35 for a 30-day supply for preferred brands for all plans. And remember that Plan G has no drug coverage, so the coverage in the pharmacy depends on which plan you take, and I don't have any specifics on that because that's through the commercial market. Here's a comparison of the different tiers, and different plans call different tiers different things. And so you can see that there are some NAs in different boxes here. And that's because that particular plan does not refer to the same tier structure the same way. UMP Classic Medicare has a value tier. You pay 5% of the drug cost up to a maximum of $10. Kaiser Original Medicare also has a value tier, and you pay $5. And none of the other plans have a value tier. Tier 1 is basically generics. Under UMP Classic, you pay 10% of the drug cost up to $25 for 30 days. In Kaiser Original Medicare, you pay a $20 copay. For Northwest Senior Advantage and Kaiser Washington Medicare Advantage, you pay $20. For PEBB Balance and PEBB Complete, you pay $5. Tier 2 tends to be preferred brands. Sometimes it's low cost generics, or it's high cost generics as well. For UMP Classic, it's 30% of the drug cost up to $75. And this tier includes specialty drugs just for UMP Classic. Under Kaiser, preferred brands, $40 for all of the Kaiser plans, and for the MAPD plans, the copay is $45. These copays are for 30-day supply across this whole chart. And you can get your drugs depending on the plan. Kaiser has their own pharmacy. There are networks, and I will tell you that the UMP network is very broad. It includes box stores, drugstores, groceries, and United Healthcare's network is at least as large, and in some cases larger, and also includes box stores, grocery stores, pharmacies, etc. Tier 3 is non-preferred generic and brand name drugs. And again, this is not how UMP Classic Medicare classifies their drugs. For the Kaiser plans, you pay 50% of the drug cost up to a max of $250. For the MAPD plans, you pay a copay of $100. Tier 4 is specialty drugs. Again, not in UMP Classic. It's also not in the Kaiser Original Medicare. For the Kaiser Northwest plan, you pay 50% up to $200. And on Kaiser Washington Medicare Advantage, it's not applicable. For the MAPD plans, you pay $100, but specialty drugs are limited to a 30-day supply. So whether you do mail order or retail pharmacy, you can only obtain a 30-day supply. I'd like to talk a little bit about mail order pharmacy. So in all the plans offer mail order pharmacy possibilities. Some of the plans have a benefit if you use their preferred provider so that you save on the copays. You pay 2 times the copay for 3 times the amount of drugs. So usually on a mail order refill, you get 90-day supply, but if you're using the preferred mail order pharmacy, you only pay for 2 times the 30-day copay. And United MAPD does not require you to use the preferred mail order. You could go to retail, but you would pay 3 times the copay for 90 days. I'm going to pause here and see if there are any questions that I can answer at this point. Mary?
All right. Some people wanted to know a little bit more about the difference between Medicare Advantage and the third one on that chart. Have you gotten to that yet?
Yes.
Okay. And so if you could explain that a little bit more.
Sure. So a Medicare supplement plan, which is the third category here, covers, it's called Medigap because really it's designed just to pay the gap that Medicare doesn't cover. So Medicare, traditional Medicare, covers 80% of the costs, leaving 20% uncovered. Medigap plans cover that 20%, so you have nothing out of pocket, and all it covers is what Medicare doesn't cover. So it has to be a Medicare service. Coordination of benefits covers what Medicare doesn't cover. It helps pay that 20%, but coordination of benefits plans also offer additional benefits like chiropractor, acupuncture, massage, things that are not covered generally by Medicare, but they are covered by the plan. So UMP Classic, for example, coordinates the medical coverage with Medicare. They pay for things that Medicare doesn't cover at all. And then they have pharmacy coverage that the plan itself is paying full rate on, and Medicare doesn't interact with the plan at all for the Medicare part, for the pharmacy part of it. Medicare Advantage is a different way of coordinating the fee-for-service Medicare model. So the Medicare Advantage model was created to have carriers provide more control over cost containment. And the way that the plans get money is they get a risk based on the risk. Remember, we talked about risk pools that assess the general health needs of a population. So Medicare Advantage plans receive money from the federal government that covers all of the people that are covered by the plan. And the plans use that money to balance how they meet the needs of providing the right care at the right time for their clients. And again, Medicare Advantage plans run very many different models. There's a difference between what's available on the commercial market. So those are sometimes called individual plans. And I know that many of you are very aware of articles that have been written, and there's recently a judgment came out against a company. That company does not have any Medicare Advantage plans with us. It does not deal with the group Medicare Advantage market. It only deals in the individual market. So the group waiver plans are designed to have many more protections than the individual market. And PEB, as the employer, sort of stands in between our members and the plan so that we can escalate problems and things like that. Medicare Advantage is like a package. So what you're doing is you are assigning your Medicare benefit to the carrier, and they are, in turn, are providing all the services that you require, and that's how Medicare Advantage works.
Okay, a couple other questions here, Ellen. UMP Classic, we need to remind people that that is not being taken away. And there's a
Yes.
question related to that, is wanting to know if their husbands could be on another plan. If they're on UMP Classic or any plan, could their husband or spouse be on another plan?
So the basic rule is in PEB, you and any dependent, so a husband would be a dependent, you and any dependent have to be on the same plan. There is an exception if one of you is on Medicare and the other is not on Medicare. Because, for example, if one of you is on Medicare and is in one of the United plans, one of the MAPD plans, we don't have a companion plan that can go with that for the non-Medicare person. United doesn't have a non-Medicare plan for us, and therefore that non-Medicare member would be on UMP Classic. The only other way to be on different plans is if you both have independent eligibility for PEB.
Okay, another question is, what is the recourse if you get a denial? What can you do about that?
So all of the plans have appeals. The first level of appeal is always to the plan, and then Medicare plans have a second level of appeal that goes to an independent review organization. And I will tell you that denials are more common in the pharmacy area than they are in the medical area. And the most common cause is usually either the need for a prior authorization that wasn't completed properly, or a billing issue with the way that the bill was presented was not done right. And although the Medicare requirement is the plans have to have complete information within a certain time frame, otherwise it automatically goes to denial. Those are very quickly resolved after they get all the information that they need.
Okay, excuse me if you have already discussed this, guys. I'm monitoring the
That's
chat,
fine.
and
That's fine.
I just listened to you background. Have you gone over about the advantages of staying with PEB yet?
Not yet. I will
Okay,
get to that.
okay, so
I
that
will
will be
get to that.
coming. Okay,
Yeah.
so continue on.
That's
Thank
a
you.
trailer. That's the movie
Yeah.
trailer. It's coming.
Yeah.
Okay, so let's go back. Were there any other questions about the drugs or the medical benefits?
I don't think so, that aren't covered by the presentation.
Okay, we can go back if they come
Yeah.
up. Okay, so the next slide happens to be why PEB.
Oh,
So as I told you, it was a movie trailer.
yes.
So PEB is an employer group, so we're like a union, and we consolidate the market basket. So we drive negotiations because we have 600,000 covered lives. We have the ability to, get the best possible plans. And as I said, PEB can intervene when escalation is needed. So for example, if there is a denial or there is an appeal and somebody is unhappy with things, or there's a problem getting bills paid, then PEB can intervene. And the email address that Mary has kindly provided to everybody is a place that you can send a request for escalation if you need help getting something paid or you need help understanding something, etc. The other and perhaps most important reason to choose PEB is if you are in PEB, you can change your Medicare plan every year during open enrollment. So that means you can go from a Medicare Advantage plan back to a coordination of benefits plan, or you can go from a Medicare Advantage plan to a Medigap plan, and you can go from a Medigap plan to a Medicare Advantage plan or to a coordination of benefits plan. So there's no restriction on rejoining traditional Medicare. There's no medical exam required. You just change your plans, and there's no added fees for health conditions. So you can't be charged more for a pre-existing condition. And finally, in terms of the commercial market, as I've sort of hinted at, PEB plans are much richer and provide lower costs overall. So many of you have seen ads, and especially we're about to hit Medicare open enrollment, which starts in mid-October. So you'll be getting lots of ads and lots of information about zero premium plans. It is very important to read all of the fine print because zero premium plans usually have a very high out-of-pocket limit, and they don't cover as many things as our plan covers. And so it's really, there is a difference. Having a group Medicare Advantage plan, especially a preferred provider organization plan, is a big benefit. One of the things that I want to mention about the MAPD plans, not only are they nationwide, but they do not have a difference in cost share. Remember, that's copays. They don't have a difference in copays between seeing somebody who is in network, which means they have a direct contract with United Healthcare, or somebody who's out of network. If they are out of network, but they take Medicare, they can and will see you. You do not pay any different amount to them than you would to see a network provider. I'd like to spend a few minutes now on non-Medicare retiree options. So non-Medicare retirees are people who retire before age 65, so they're not yet Medicare eligible. When you retire, you move to PEB, regardless of whether you're on Medicare or not. The plan options for non-Medicare retirees are the same as those available to active PEB employees. So for people who are maybe currently working right now in education, right now they're under SEB. And if they retire, they would move to PEB. And there is some difference between those. One of the things is that in SEB, there are separate vision plans, but in PEB, vision is embedded or included in the medical plan. So you don't have a separate plan, it's automatically covered under your medical plan. And then the Primera plans that are in SEB are not available in PEB. Why does non-Medicare coverage cost so much? So as a retiree, you no longer have access to the employer contribution, which is how the legislature has funded reductions in premiums for employees. So as employees, your labor organization works to do collective bargaining, and they figure out what the employer contribution is going to be to the Medicare premiums. You also, because you are a non-Medicare retiree, don't have access to the Medicare explicit subsidy, which is also funded by the legislature. So I want to go back for a second to the Medicare premiums. These premiums have been reduced by the Medicare explicit subsidy. So this, what's showing here is the premium after the Medicare explicit subsidy. The Medicare explicit subsidy is $183 or 50% of the premium, whichever is less, and it is applied, and that's per month. So this has already been applied. That's why these premiums are so low. But if you're a non-Medicare, pardon me for the scrolling, if you're a non-Medicare retiree, you don't have access to the Medicare explicit subsidy. So there's nothing else to reduce the premium. As appropriate, tobacco and spousal surcharges are applied, so that increases the cost as well. And there are some alternatives. You can defer PEB coverage if you meet the requirements. You might have other employer plans available, which include perhaps you have a spouse who's working not for the state, not for PEB, but is employed at Amazon or Boeing or whatever, and they have employer-sponsored insurance. If they could cover you, then that gives you a reason to defer your coverage, or you may choose COBRA. So COBRA coverage, let's talk a little bit about that. It stands for the Consolidated Omnibus Budget Reconciliation Act, which I think is a huge mouthful, so we refer to it as COBRA. It's sometimes called continuation coverage. The purpose of this is just to provide a temporary bridge, and it covers up to 18 months in most cases. And once your employer-sponsored coverage ends, for people who are within 18 months of turning 65 and becoming Medicare eligible, COBRA may be a good alternative. But COBRA is also fairly expensive. And again, you may choose not to have COBRA because one of the reasons for deferring is if you have a qualifying Affordable Care Act, ACA plan that you can get from the Health Benefit Exchange. Some of those plans are very reasonable, and you could take that to cover you until you turn 65. But you also have to remember to defer your PEB coverage. It's not enough just to get your health coverage elsewhere. You have to tell PEB that you are deferring, and you have to fill out the forms to make that deferral. These are the non-Medicare subscriber rates, so you can see they're very expensive. And again, the reason is there's no longer an employer contribution and there's no Medicare explicit subsidy. So these prices are very high. This would be the same cost for COBRA coverage. And finally, I wanted to give some resources. I want to remind everybody, open enrollment for PEB starts November 1st. That's very different from the Medicare open enrollment. Again, starting in October, the federal Medicare open enrollment begins, and you will receive lots of information about it. You'll hear lots and lots of ads about it. You'll hear ads on TV, radio, you'll see them in the newspaper, etc. That has nothing to do with PEB. You still have to comply with the PEB requirements. So the PEB open enrollment begins on November 1st, and all the forms have to be received by HCA by November 30th. So if you take nothing else from this seminar, please take these two facts. You can't start it until November 1st, and you have to make sure that we receive it by November 30th. Here's the HCA website. Once you get on the website, across the top, there's a way to get the specific kinds of people involved. So you can see retirees is a drop-down box. If you are looking at Explore PEB and SEB benefits, you'll see a drop-down for retirees. And there's lots of information on the retiree page. PEB customer service. This number is 1-800-200-1004. And these folks are your best friends. They can tell you all the ins and outs of enrollment, all the things you need to comply with. They know how to best set you up. They can tell you about deferral. They can tell you all of the requirements. And if you have general questions, now before open enrollment happens is a good time to call them because they're much less busy right now. And I apologize for the mistake in the SHIBA number that there's a missing dash, but the SHIBA are the statewide health insurance benefit advisors. These are volunteers who work with especially retirees. And this is under the aegis of the Office of the Insurance Commissioner. And these folks can provide a lot of information, especially about Part D plans, but they can also give information about PEB plans. And their number is 1-800-562-6900. And that's my presentation, Mary. So if there are more questions, I'm happy to answer those.
Okay, there are more questions. Where do they go to find comparisons of plans, like the difference between UMP to PEB complete?
So HCA website has a plan comparison tool. Now remember, open enrollment hasn't started yet, so it has not been updated yet for 2024. But you can see how to work it by looking at the 2023 information. There's also the PEB retiree enrollment guide. Again, right now, only 2023 is available, but by the end of October, the 2024 version will be available. And that booklet has a page by side-by-side pages that compare the different plans and different benefits. But keep in mind, these are not every benefit, not every specific situation. So you still may have questions that you need to go to the plan or look at the plan summaries to get more information about. The best place to go for specific information is directly to the plans.
Okay, and then we have a question. If you are on PEB, can you add your spouse? Like, let's say the spouse retired 5 years before you did. And so can you add a spouse?
Yes, during open enrollment every
Okay.
year, you can add or remove a dependent.
Okay, perfect. And there's, could you explain the difference? The $183 a month, that it doesn't have anything to do with the Medicare subsidies that some insurance plans get.
Oh, so yes, unfortunately, the term subsidy is used in two different contexts.
Right.
So the Medicare explicit subsidy, the $183 or 50% of the premium, whichever is less, that is money that was set aside by the Washington State Legislature to lower premiums for Medicare retirees. When people talk about federal subsidies, those are through the CMS, which is the Center for Medicaid and Medicare Services. And CMS provides money directly to Medicare Advantage plans, and those are called subsidies. And those subsidies lower the cost of medical claims. And in fact, because of the coordination of benefits, those plans that have coordination of benefits actually take advantage of some of that lowered cost. But the primary subsidy that we talk about is the subsidy for pharmacy, and that goes to Part D plans only. And the CMS subsidy is almost 75% of the drug costs. So there's a huge subsidy that goes to those companies, and they use that money to lower their premiums.
Okay, there was a question about what the initial CMS stand for.
The Center for Medicaid and Medicare Services.
Okay.
So that's basically when we're talking about Medicare, that's who we're talking about.
Okay, and some people on Medicare are finding that when they need services, that they're being asked for referral when it's not a PEB policy, like for UMP to get referrals, that they're asked for referrals and they're told by the providers that it's because of a Medicare rule. Is that correct?
It could be. So
Okay.
there are some services where Medicare requires a referral. And there are some services where Medicare requires prior approval. And those things might not have applied generally to the active population, but because of Medicare rules, they would apply. across the board, because again, the medical claims in UMP Classic Medicare are handled by Medicare.
Okay, and then what are the requirements to defer? When should you defer and how do you do it?
So you have to defer within 60 days of retirement. And you apply to PEB for that. And basically you have to have a comparable, you have to have health coverage that is comparable, so you're not left uninsured. So you can either be covered as a dependent on PEB or SEB through somebody else. You can be covered as a dependent through non-state employer-sponsored medical coverage. You could be on TRICARE or CHAMPA, or you could have a plan from the Health Benefit Exchange that provides coverage.
Okay, and
So
then there was
coverage somewhere.
There was a question about Plan G, and if you could you explain that a little bit more about its own plan?
So Plan G, so there are a number of different plans that are designated by alphabet. Plan G is Plan G covers the 20% that Medicare does not cover and it only covers Medicare services. And the difference between Plan F and Plan G, Plan F used to pay the Part B, like boy, deductible in Medicare. And in 2020, I believe, CMS decided not to allow that anymore. So the member has to pay the Part B deductible. The Part B deductible is currently $233. So on Plan G, you have to spend the first $233 and then you don't spend anything else after that. On deductible for Part B is set by CMS later in the fall. It's usually sometime in November. So I don't know what the figure for 2024 is going to be, but currently it's $233.
Okay, we have a question here about if you're a high income earner, do you need to pay Part D? Would depend on the plan.
Yes, so Part D is drugs, and it depends on the plan. In the PEB portfolio, only the MAPD plans have Part D. So let's assume you're a high income person and you pick one of the MAPDs. You would pay an IRMA, an income related monthly adjustment amount on both the Part B cost and Part D, even though you're not paying a separate premium because it's included in your premium for the MAPD plan, you do have that Part D assessment. If you're not on a Part D plan, if you're on any other plan, so you have creditable drug coverage, you would not pay that adjustment for Part D, but you would have to pay it for Part B. Remember that you have to pay your Part B premium directly to Medicare, separate and apart from any premiums for our plans. And being on Medicare Part A and Part B is a requirement in order to enroll in a PEB Medicare plan.
All right, let's see. My chat is being a little wonky right now. Come on, stay with us for a little bit here. I'm going to open it up. This is a dangerous thing. We can't have 300 people asking a question, but if you have a question, Nancy has a question, and let's keep them really brief. And remember that you can send an email question. So, okay, go ahead, Nancy.
I believe that UMP covers medical care out of the country. And I'm wondering if the PEB Complete Medical Advantage plan also does.
Nancy, thank you so much. I meant to cover that and I forgot, so I really appreciate the question. So first of all, on Medicare, Medicare itself covers emergency care outside the country. So all plans cover that. However, UMP also covers non-emergency care. So let's say you get sick, but you don't have to go to the hospital. You know, you sprain your ankle, but you don't break it. So then UMP Classic covers non-emergency care outside the country. And the PEB MAPD plans, both of them, PEB Complete and PEB Balance, cover non-emergency care outside the country. In both cases, whether it's MAPD or UMP Classic, you have to pay up front and get reimbursed.
All right, Cookie, ask your question.
Okay, this is a quick question. And so I'm going to turn 65 in January, but I'm still working, okay? And I plan to continue to work for the rest of the school year and maybe half for the next one. All I need to know is, do I need to apply for Medicare Part B or A? Because I'm still getting insurance, full insurance from the school district.
Cookie, that's a great question. So here's the news. Medicare Part A, you have to sign up for. You don't pay for that as long as you've worked at least 10 quarters for a FICA contributing position. Then you don't pay for Part A, but you have to sign up for it. And then you do not have to take Part B. You defer your Part B, like boy, because you are covered by employer insurance.
Okay, so let me get this right, because I'm this visual person and I'm writing this down. So I'm trying to get this in my brain. So what you're telling me is, when that open enrollment comes up, I need to apply for Medicare Part A, even though I'm not paying for it. I don't have a fee-based pay for it, but I need to sign up for Part A.
Yes, but not with PEB. So you can actually, you're turning 65 in January. So starting in 3 months before, so that would be October, right? Well, actually September, October, November, December. 3 months before you turn 65, you can apply to Medicare, and you have to go to the Social Security Administration to do that.
So I apply to
So
Medicare.
it's not with PEB, but you have to sign up with the Social Security Administration, and you're going to sign up for Part A, and they will, and just tell them that you're working. They'll give you all the information about that.
So I go online to the Social Security Administration.
Yes.
Okay, and then just tell them that I'm working, and
Yes.
then they'll direct me in the right path to get on Part A, which I don't have to pay for, but I need to do that.
Yes.
And then Part B, I can defer
You can
that.
defer until you apply for Part B when you are retired and no longer employed.
Okay, I just want to make sure I have everything right, because I don't want to be 65 and mess up.
Okay.
Right.
All right.
Thank you. Okay.
you.
Robert.
Okay, this could seem like a dumb question, but I did ask it in the chat. It didn't get asked by Mary, so it might be a dumb question.
There are no dumb questions.
Well, if I don't know the answer, it's not dumb. That's what I figure. We don't pay for Medicare Part A. So if you go back to the sum benefits comparisons page under the column hospital, I'm asking, are these numbers in addition to Medicare Part A? But they must be, I mean, in addition to zero. So that's all I'm asking, I guess.
Yes, so these are co-pays. So
Right.
yes, Part A is going to cover your hospital benefit, but in addition, some of these plans have a copay that you have to pay as well.
But why do I have to pay a copay if Medicare is covering the hospital?
Because remember, Medicare pays 80%.
Oh, got it. Okay. All right. Now on the enrollment question, I do need to be confused. I have been babied by the fact that I've been a dependent because my wife is still working. And she's planning to retire. Well, one date she's proposed is December at the end of next year. So we need to get on this enrolling for the rest of Medicare October, November, December of 2024, just before she retires. Is that correct?
Yes, so in 2020, so for the calendar year 2024, you'll be covered by her employer insurance.
Correct.
Yes, but then starting November of 2024, looking towards January of 2025, you're going to have to make a choice.
Correct. Okay, thank
Yep.
you.
You're welcome.
All right, Cynthia. You're on mute. Yeah, there you go.
So I changed to United Healthcare, the complete UMP.
Well,
Um,
UMP and United Healthcare are two different plans.
United Healthcare, United Health.
Okay,
I got my card here to see what
yeah,
it's.
United Healthcare PEB complete, yeah.
I changed last year and there was a lot of paperwork. Now, when we want to renew, what do we have to do?
If you want to renew and not change,
Mhm.
you do not have to do anything. We will automatically assume that you're staying in that plan.
Ah, wonderful. Thank you. Okay.
Sorry, it's painful the first time, but
Yeah.
the benefit is as you stay, you don't have to do anything.
Thank you.
Marna.
I have a couple questions. The first one, could you go back to the screen that talks about first pharmacy and then drug benefits?
Yes, so I'm on the, so this is the drug
Okay.
benefits.
So this has drug benefit comparisons, and it says the Kaiser ones have no deductible and no maximum amount of pocket.
Right,
And the next one tells you that
What
there's
the copays
$20.
are.
See, what's the difference?
so a deductible is, let me see if I can explain this. The deductible is the amount that you have to pay before the plan kicks in anything. So there's no deductible, but every time you go, I'm just going to pick one here. Let's say Kaiser Original Medicare Tier 1. I'm going to have to pay $20 copay for my
Okay.
prescription.
So, okay, so that doesn't benefit you if you automatically have to pay anyway. So, okay, so got that.
Okay.
And then the other, oh, sorry.
1 second, sorry. The way that the deductible works is you pay that first. So for MAPD, there's $100 deductible. It doesn't apply to Tier 1, but it does apply to Tier 2. So if you get a drug and it costs $60, you have to pay that first $60. You have to pay until you pay $100
Okay.
before
Okay,
the
so
plan
yeah.
kicks in.
I'm trying to confuse deductibles and copays in my mind, so sorry about that.
No, that's fine. It's a great clarifying question. I appreciate it.
Okay, and then the other questions that I have are about dental. And I see lots of questions in the chat about dental. Any other outside of PEB Kaiser plan includes dental, and yet we don't have that available to us through the Kaiser plan. And I'm seeing lots of dissatisfaction with the dental plans that are there. I don't have dental insurance currently because what they pay on it seems so low for basically $50 a month or something like that. But I'm wondering why the dental is not included in any of the healthcare plans as it is in many plans, and why we're so limited in our dental options, because most dentists won't take my dentist won't take the option that we have.
So again, a great question. So let me parse it out a little bit. We don't have, a decision was made by the boards about how to provide benefits, and they decided to have separate dental benefits. So dental is an option that you could take or not take. In part, dental is always paid for by the employer if you're active employee. So it's sort of an added way of providing a benefit. In terms of Kaiser and some other plans that are available in terms of dental coverage, Delta Dental, which is like a large network, like a carrier, They're not, because it's a different kind of dental is different, but their network covers about 82%, 83% of all the providers in Washington state. So having different plans doesn't really provide a lot more coverage, because most dentists are under the umbrella of Delta Dental. Now, we do have two different plans under Delta. One is Delta Care, which is a managed care plan. So it's a balance of a limited network, but very low cost. So fewer providers, but very low cost. The other plan is the Uniform Dental Plan, which is the state name for it. It is a PPO, preferred provider plan. The plan pays the most if you see a preferred provider, but you can also see a premier provider or an out-of-network provider, and the plan pays some, but not as much. And, you know, the cost of everything is going up, and I understand that there's questions about the need for a dental plan. I will say that, you know, especially for the older population, good oral health is very, very important, because it leads to other things. And preventive services are $0 copays. So, you know, if nothing else, it's important to have the preventive visits and be sure that somebody's looking at your oral health.
Okay, so the plans that we had, the Delta Dental covers 82% of the dentists, but not most of those do not do anything but the preferred. So you still have the higher costs. Is that correct?
No, most of them are preferred providers. It really depends whether you're in the Delta Care network, which is the limited network, or not. Marna, I would invite you to send a question to the PEBB Medicare address, and I can take this offline and give you more information.
Okay, thanks so much. I appreciate that.
You're welcome.
Perfect. Okay, thank you. Robin Hicks.
Well, my experience having been retired under the sub program, I just wanted to share with Cookie that you want to make sure that you are on Medicare B prior to applying for the PEBB insurance. That's what I found to be true when I retired. And the other thing too is if you were on Primera prior to when the state put us under SEB, Primera did not give us that, what do you call it? That they didn't share the information that we were on Primera prior to that. So I had to do coordination between Primera and Medicare so that they realized that, yes, I did have insurance prior to 2019 when SEB was instituted for us. So you need to make sure you do your research way ahead of time and get your ducks in a row and stay close to your payroll and benefits person, because they can help you out.
Okay, thank you. April. Go ahead. There you go.
I'm here.
Okay.
I have April Seaman. I have a timeline question. So I am 64. I retired, and I'm covered on my husband's medical for the Seattle School District, and he's going to retire June 30th, 2024. We'll both go on Medicare, but if open enrollment isn't until in November, how do we stay covered through July, August, September, and October and November?
You don't have to worry about that, because retirement creates a special open enrollment period. So retiring, separating from service, losing your insurance, qualifying for Medicare, those are events that trigger a special period, so you can enroll mid-year for those.
Okay, and so I deferred, and so then I just go on. I just go choose whatever.
Yes, when
Okay.
when you go with him to get insurance, then you'll indicate you used to defer and now you're coming back from deferral.
Thank you so much.
You're welcome.
Okay, Kay.
Thank you so much for doing this. First of all,
welcome.
I'm pretty nervous about after 20 years from going to the classic UMP Classic to the UHC Complete. And my major question for my husband and me is, are we going to have any trouble getting providers to take us when we go in January with our new cards and we're on something different? That's my worry.
So I cannot guarantee that you won't have any problems. First of all, let me say that. But let me also reassure you that all the major provider groups, if they're taking UMP now, they would take UHC. It's important to talk to your provider, give them a heads up that you're thinking of switching, and tell them that you're going to a group Medicare Advantage PPO plan. Because a lot of providers, and especially their billing offices, don't recognize what's PEBB, what's PEBB complete, we don't understand what this plan is. And so they may say out of hand, no, we don't take it, when in fact they do take it. So if your provider says, well, I don't know, or I have questions, you can send an email and I can double check and see if the provider is actually submitting claims to United.
Thank you so much.
You're
Hey,
welcome.
Joanne.
Hi there. Thank you so much for doing this.
welcome.
I just had a dental question. Are you going to be continuing the Willamette coverage as well?
Yes, yes. Willamette
good,
is the third
because-
plan that we have, yes.
I'll just tell people if you have it in the area, it really does cut costs. But if you have something emergent, it can be a challenge. So there are trade-offs in the whole thing.
You know,
Thank you.
generally speaking, insurance has trade-offs all across the board.
And
So,
for everybody, I changed to United 2 years ago. And it really pays to go in and do the research, check every single doctor through the United Healthcare website, because the front office doesn't know. They don't know.
unfortunately, that has
And-
been our experience.
And I did have one that I went to, my podiatrist, and the United Healthcare website said, yes, he was covered, and well, no, he wasn't when I got there. So just so you know.
Well,
Thank
if
you.
that's the case and you had a bill, United should be paying, so you should get in touch with me and let me know about that.
Oh, okay. That was back in May.
Even,
so-
even if it was 2 years ago, please let me know. I need the provider name, I need the data service. Yep,
Very
I would
cool.
definitely intervene for you, not interfere. I'll try not to interfere, I'm sorry.
One and the same. Kathy.
Hi, I went to Complete and live in Eastern Washington in a really small town now. And so it was really hard to figure out. There's no one that's part of their PPO. So if you just looked on their website, it didn't come up with any physicians at all within hundreds of miles. But I called United itself and told them names of physicians, and she was able to look back and see if they'd ever billed to I can't remember. Anyway, she could tell if they'd billed or not. And then I was able to pick a provider that way, because it was really hard there's just none on the websites. But if you call, and the
Yeah, the
doctors
webs-
themselves didn't really know, but the United Health was able to tell.
That's great to hear. Yeah, so they can check and see if the provider has ever submitted claims to them. And they don't have to have done that. You can see the provider anyway and get reimbursed, but it's easier if they do. And again, a lot of providers don't know. The website is limited to providers who have a direct contract with United. So it is best to call them. They're very good about checking the provider records.
And then lastly, what you said about this vaccinations, when that was the biggest issue with billing issues, that it truly was. And United called my provider, we say they put it under the wrong coding. And
Yes.
they called at least 4 times and called directly to the provider and helped them figure out, again, it's a very small town, so they were great about calling and kept saying, I don't owe it, she doesn't owe anything, this, you have to resubmit under this, that, and another. And then they also said, go to a pharmacy if you want your just straight vaccines for anything, because the pharmacists know how to bill. And they were right. It was over a shingles vaccine that they billed it
yeah.
correctly, and the pharmacy was billed it correctly this for the second one. So they were really helpful for that.
Excellent. I just want to interrupt for a sec. I know that somebody had submitted a question in writing about the RSV vaccine. And I just wanted to say RSV is one of the vaccines, preventive vaccines are covered under Part B medical. It's like infusion therapy, and it's just a weird thing that Medicare has, but some vaccines are covered under Part D, like D for drugs. So if you were in a creditable drug coverage plan, so not a Part D plan, vaccines, it's up to the carrier where they cover them, how much they cover, et cetera. If you're in a Part D plan, shingles, flu, RSV, which is newly approved, and COVID, those things are covered under Part D, like David.
Great. Okay, Sandy. Sandy Coco. She must have stepped away for her computer. Sandy, are you there? Okay, Cookie.
I'm
Okay,
here.
okay,
I'm here.
okay.
I was
Go
on
ahead.
mute. I'm sorry.
Okay.
Ellen, earlier in your presentation, you mentioned Boeing. And I know that Boeing affects people across the state, not just in the, western part of Washington. Would you clarify about the Boeing offer to their retirees?
I don't know anything about
okay,
what Boeing offers or doesn't offer. So what I was saying is you could have employer coverage. So that would be an active employee.
Okay, that's the important word. That's what I was looking for, is the active, because Boeing does offer coverage to their retirees, but PEBB does not recognize that as a legitimate coverage. And so people think they can defer PEBB and be on the Boeing plan when they aren't covered because it's not active. So that
you have to be covered by an active plan.
Yeah, okay, that's the
but
key
it
word.
could be any employer active plan.
Right.
And the other thing is PEBB does not allow any other Medicare plan to be a reason for deferral.
Right.
So you can't take a Medicare plan off the market, for example, and use that.
Right.
Thank you, Sandy.
The Boeing issue has come up in our seminars quite often. So I just wanted a clarification on that.
Great.
Thank you.
Thank you. Diane.
Thanks, Mary. Hey, Ellen, up here in Whatcom County, we have had a major medical facility announce that they will no longer take United Healthcare, and my husband just happens to go to that place. And also our Peace Health Medical Hospital employees use that same medical facility. So my concern is all these people are going to be looking for places to go. And United Healthcare isn't going to be able to, people aren't going to be able to get their healthcare needs met because United Healthcare isn't going to be accepted at that facility. So what can we do about that?
So there are other facilities in Whatcom County, and Diane, if you would take this offline and send me an email about it.
Sure.
I'm happy to give you some more information about Whatcom County.
Oh,
I do know that, yeah, I know it's an issue there.
Thank you so much.
You're welcome.
Right, great. Let's see, Cookie, you've been waiting a while here for a second question.
Okay, I just got this question again. When you explain, I'm sorry. Go ahead and take someone else. Let me come back.
Okay, Joanne, you have another question? No, okay, your hand's still up. Okay, April? Do you have another question? April? Okay, we'll come back to her. Okay, Cookie, are you ready to go again?
Yes. Okay,
Okay.
my question was that you stated that, I went online and looked where everyone was talking. And I went to the Social Security website and it says, you can sign up for Medicare. And it just had just plain Medicare. And then there was another link that says Medicare Part B. So just plain Medicare is Medicare Part A, right?
Yes, that's
Okay.
right.
Then but you said something about I couldn't sign up for PEBB.
You don't sign up for Medicare through PEBB.
Oh, okay.
You have to
Gotcha,
do
gotcha.
both. You have to do both. That's what I was trying to say.
Okay, wait a minute, I'm confused. What do you mean I have to do both?
You have to sign up for PEBB if you're making any changes, right? You have to PEBB open enrollment, but you'll also need to sign up for Medicare separately through the Social Security Administration.
Okay, so I sign up for Medicare separately through the Social Security Administration, but then I have to go on the PEBB website and sign up for Medicare on that as well?
No, you don't sign up for Medicare with PEBB at all. Once
Okay,
you
so-
have Medicare, once you retire, you're going to sign up with PEBB for retiree coverage and you will prove that you already have Medicare.
Okay, but by then I'll have somebody to help me walk me through it like you guys are
Yes.
helping me today, right?
Yes.
So only thing I need to do, I'm sorry, is just go to the Social Security Administration and where it says just sign up for Medicare, that's Part A. And then underneath where
Yeah,
it
you
says
need to
Medicare.
talk to them.
Yeah.
You
and
need to
and
talk to them.
talk personally. Can I get a live person?
I think they have a chat function as well as,
Okay.
as a live person.
Okay, all right, I think I got it. Thank you so much.
Okay, Judy.
Judy, I know you tried to unmute, but I still can't hear you.
Okay, there you go. Now you're on mute with the red now. We'll come back to you, Judy. You gotta.
Or you can put it in the chat,
Right.
Judy. You can write it up in chat or send me an email.
Okay, we'll come back just like Ellen said. Pam.
I'm a presenter for the retirement seminars. And we've been telling people who are newly retired and going on PEBB that they have to, that 60-day grace period for getting on PEBB after you retire does not apply if you're going on a United plan. Is that correct?
So yes and no. So it is best if you want to be on a United plan to let PEBB know in advance, and here's why. In order to sign up for a Medicare Advantage plan, so it's not just the United plans, it's also the Kaiser Medicare Advantage plans, you have to sign before the effective date. You cannot sign after the effective date. So you cannot put in your paperwork, within that 60 days after you retire, if you expected the insurance to be effective the first day of retirement. You have to sign up for those plans in advance.
Thank you.
All right, Deborah.
Hello, can you hear me?
Yes.
Yes.
Okay, I am currently with shoot, now I forgot. the very good plan.
UMP.
Right, but it's getting to cost. And what I've been hearing is that the United Healthcare Plan is also nationwide. It is, and it allows you to, it's a PPO, so I would only, okay.
It's a PPO, so it's a very broad network. You can see virtually any provider that you saw under UMP would also accept the group Medicare Advantage PPO plan.
Okay.
And then if you have specific questions about providers, you can send me an email and I will double check.
Okay, I think I will do that. And that's your email on the right now on the screen.
Yes, that is.
Okay. And what side, that's the biggest difference between the two, because the price is so different.
Structurally, they're very different plans. UMP is a self-funded, it's the state's plan. It's just structurally, it's different. It's like the difference between a house and an apartment building.
Okay. Because I hate to give it up, but okay. Thank you so much. I will email you.
Okay, great.
Okay, Judy, are you able to unmute now? We still can't hear you. Sorry, you have to put it in the chat or send an email. Sorry about that. Nat.
Yes, I live on Whidbey Island, which means I'm considered a rural area, and I'm also one of the Sheba volunteers for my area. But I really have a concern about some of the things that United Healthcare is doing. It's telling people that they will accept from any doctor. I have found that 3 of my 4 specialists do not accept United Healthcare because they've had problems in the past with it. And I can't convince them that the plan through PEBB would be different. I think the biggest concern that people should be aware of with Advantage plans is that when your doctor recommends a particular procedure, perhaps maybe it's a joint replacement for a knee, he does or she does not have the ability to say, hey, okay, let's do it. They have to get the approval of the United Healthcare for that surgery. And I have worked with a number of clients as a Sheba advisor who have had delays of 3, 4, several up into the 7 or 8 month period of time in terms of getting their surgery approved by United Healthcare because they wanted additional information or additional verification that the surgery was really needed. I think that people need to be really careful in choosing the plan that they have and that the doctors that they have, and find out if their doctors accept the plan, if they're happy with the plans. And it may not be totally up to the doctor. It may also be the billing clerk who gets so frustrated that that their clinic or medical office will no longer accept the plan. I think the other thing that the people need to be aware of is that if they have a priority or preferred hospital facility, to find out also if they are accepting the plan, as more and more hospitals are no longer accepting any plan from United Healthcare. In contrast, I think the plans that are available through United Healthcare are very good plans and very ones that can meet a lot of members' needs. I think they just need to make sure that their providers and that they're, whether it's a physician, nurse practitioner, hospital, will accept it, and to make sure each year that their drugs that are covered this year will continue to be covered next year, because that's another problem that virtually all Advantage plans have, and it's been true with United Healthcare also, that they often change the drugs that are covered, and they are limited as to the amount or as to the drugs that they can take. So, and that's true with any plan, is make sure that you know it. I'm going to further add is that people should, if they're looking to save money, Plan G is a very credible plan. And a Sheba volunteer can work and help you find a drug plan. And oftentimes the two combined can save you a fair amount of money.
Okay, thank you.
I think that's great. And you're absolutely correct. An informed consumer is always a better consumer.
Okay, Susan.
Yeah, I have a simple question. I'm on UMP and I've been told that if I go off it, I can't go back to it. Is that true?
That's not correct. No. In
Okay.
PEB, every year at open enrollment, you can switch from any plan to any other plan. UMP is not closing. It is not going away. You can choose to be in it and you could choose something else for a year and then decide to go back to it. And that's perfectly okay. It's
All
one of
right.
the benefits of being in PEB.
Thank you.
Thank you.
Kay.
Oops. There we go. Okay, I use a drug card for my Eliquis. And I'm wondering now, in going from the UMP Classic to the UHC PEB Complete, if I can still use my drug card.
No, you cannot use your drug card because the MAPD
Okay, I was
plans are
afraid of
Part
that.
D plans, and you cannot use it for Part D, but the cost of Eliquis is controlled by the tier that it's in. And if you want specific information, you can send me an email and I'll get you information on it.
Thank you so much.
But the drug cards are not acceptable.
I was afraid of that. Thank you.
Hey, Diane. Diane, did you have another question? Okay, we'll come back to Diane. How about Pam? Oh, Diane's there. Okay.
I'm so sorry. No, I
That's
do have another question. Let me lower my hand.
Okay.
Thank you.
Pam lowered hers. Judy, can you write in the chat? Okay. Okay. Anybody else have any questions? You guys have done a really good job on the questions.
I wrote into the chat. This is
Okay.
Tamara Jones.
Okay, you want to go ahead and state your question?
Yeah, I was not able to join earlier. I couldn't get in. And so I missed part of the presentation. My question was, did the PEB price increase to around $800? Is that the fact for next year?
UMP Classic for next year, for one person.
That's retired, of course.
Right. For one person, UMP Classic is $532.94 a month.
Okay.
That's just one person.
Right. So that doubles with my husband. Okay.
Yes.
You will be getting the PowerPoint and the recording, so you don't have to worry about the part you missed.
Oh, perfect. Thank you very much.
You are welcome. Cookie, you have another question?
Yes, I do. I don't know. So when I do retire and I plan on leaving Washington and going to Arizona, what changes with my Medicare?
So nothing changes with your Medicare. Medicare is nationwide.
Mm-hmm.
But if you want to get a health plan through PEB, you're going to want one of the plans that is nationwide or that covers you in Arizona.
Oh, okay. So I could do either the United Healthcare, the Premier Plan G, or that UMP, because those are all nationwide.
Correct.
Okay, that's all I needed to know. Thank you.
And then when you do that, it's not like the woman who's from Whidbey Island said, it depends on, where the providers are. Once you move, you can let us know what providers you're using and we can double check. But I know that in Arizona, there are lots of providers who take the plan.
Okay, thank you.
Mm-hmm.
Okay, if you, okay, Judy, if you could rate or put your hand down, that would be good. If there's any more questions? Some of you, I probably missed a few on the chat. And the questions, I really appreciate receiving the questions before I gave those to Ellen, and she's incorporated some of those things. I would really suggest people contact Sheba like now if you're really having a hard time deciding what would be best for you, because they will help you. It is a hard decision. Any healthcare program is great if you never need to use it. So there we go. It's always a guessing game. Any other questions? Okay, and so you are getting the recording, you are getting the PowerPoint, you do have an email to contact
Mary,
HCA.
Sorry, it looks like Julie Winchell has her hand up.
All right, Julie, go ahead. Oh, sorry, there you are.
I just had a question about UMP Classic Medicare, that $532 premium. Do people who sign up for that also have to pay their Medicare premium every month, either through the Social
Yes.
Security deduction? They do?
Yes.
Okay, thank you.
Yes. All of the plans require that you pay your Medicare Part A and Part B. Usually there's no Part A premium, but your Part B premium, as well as the HCA premiums.
Okay, thank you.
Okay, Carol. Carol, ready, go ahead.
Had to unmute here.
Okay.
Is there somewhere where we can see the drug formularies for the various plans?
So the drug formularies are online in the information that we have. So 2024 information is not available yet, but the 2023 information is. So if you go to, for example, the HCA website and look up, one of the United plans, when you get the information and the plan guide, there's also a drug list. And if you have any questions and can't get it, just send me an email and I'll get it for you.
Is there a big variation in what medications are covered by which plan?
There's not a big variation. There are differences in formulas. There are differences in which tier they're in, so how much it costs under each plan. But basically, the most popular drugs are covered by every plan.
Okay. Well, thank you.
All right, we have Lee and Dean.
Hi, I'm 61 and I'm on the UMP right now, which is going up to 830 something bucks. I mean, that's over $10,000 a year. Is there anything else I can do? It sounds like I can't leave PEBB if I ever want to come back. I've been retired for 3 years.
Are you currently working or you're retired?
Retired 3 years ago.
Okay. There's really, and you're not yet 65, is that correct?
61.
Why don't you send me an email, because there might be something that you can do to defer, but I have to see because you've already been in PEBB, so I have to work with an eligibility specialist and make sure.
Okay.
So if you
Thanks.
send me an email, that'd be great.
Will do.
Okay, Julie, do you have another question? Your hand's still up.
No, sorry.
Okay, that's okay. Kelly, you have a question.
Yes, I wanted to know, this was mentioned earlier. My husband is going to be retiring now. I retired 2 years ago when I was 65. Can I go ahead and add him on now during the open enrollment?
Yes, you can.
Thank you very
You
much.
can only add him during open enrollment, but yes, you can.
Thank you.
Okay, anyone else have a question? Okay, I just put the, okay,
Looks
I
like
just,
Holly.
oh, Holly. There you are, Holly, go ahead.
Yeah, I'm confused because there are some plans that I can't get because of the area code I'm in. Could you please explain that? Because it very much to me feels discriminatory.
So only the Kaiser plans have regional limitations. And that has to do with their agreements with the Office of the Insurance Commissioner on where they can provide coverage or not. All the other plans are nationwide. So where are you located?
I'm out in Grace Harbor County,
Okay, so there are
10
differences
miles
in zip
away.
codes.
10 miles away, I can be on Kaiser and save a lot of money.
Yeah, it has to do with where Kaiser has the coverage and their agreements with the Office of the Insurance Commissioner.
Okay, so United doesn't have it.
No,
'Cause they're
the other plans are
nationwide.
nationwide, yes.
Okay, so only Kaiser. All right, thank you.
You're welcome.
Okay, any other questions? These have
Can
been
you hear
great
me?
questions.
Can you hear
Barb?
me?
Barb?
I have a question.
Okay, go ahead.
My insurance is UMP Classic Medicare. I am retired, and the price, I'm just talking about myself as a single subscriber, and it's going to be up over $500 for next year. And I've had that since I've retired, and I've liked it, but because there is such a price difference, I'm considering healthcare PEB complete. And I'm just wondering what I should do to make, do I go to the United Healthcare website and see, or do I go to my doctor and talk to them and see if they would cover United Healthcare?
So you can start by asking your provider and remind them it is a group Medicare PPO plan.
Okay. All right. And another question concerning that, have many people that have had uniform in the past gone to United Healthcare? Do you have any way to tell whether they've been happy with their decision?
So, you know, last year we had about 9,700 people, something like that, switch from UMP to United Healthcare. I have not heard complaints. That doesn't mean that people are happy. Some people haven't used the plan yet. I really can't answer that.
Well, I did speak with one person in my community who was has gone to United Healthcare PEB complete, and they were also with uniform before, and she was extremely happy. But then I saw on the website from one of the Sheba people saying that United Healthcare isn't always accepted by medical.
So again, you know, it depends on the particular provider, and you know what, we can help you troubleshoot and find out if the provider is accepting it. But a lot of providers say they don't take United, and it turns out that they're actually submitting claims. So we know that they do. So I don't know what to tell you on that, but happy to respond if you send me an email.
And to reach you, is that the one that
the HCA one?
The HCA one, that's the one I need to write to. Thank you for your help.
Okay, thanks, Barb. Nat, you're on mute.
Got it. Yes. Just if people are considering switching from a plan, and I don't blame they are, because United Healthcare is way more than many retirees can afford. Very good option is the Plan G, because it operates very similar to Uniform Medical. It's just, you just have to get a separate drug plan to go along with your Plan G. And this is one area that Shiva volunteers are really good at helping you find the best drug plan for your medications to match up with Plan G or Plan F if you have Plan F already, in terms of getting the best drug plan at the least cost with the pharmacy of your choice. So I don't want people to think that they only have the option of going to United Healthcare, when in fact, a lot of the people I know, when they dropped uniform, went to Plan G this last year.
That's correct, and we had probably 2,000, 2,500 people switch to Plan G. It's a very comparable plan.
Hey, Elizabeth. Whoops, you're mute. You went off.
Okay.
Okay.
Okay, thank you. Just a quick question. I am also thinking about changing because of the high cost of the uniform. And my question is just, is United Healthcare a PPO?
Yes, it is a PPO, and there's no difference in copays between seeing an in-network provider or an out-of-network provider.
Okay, that's all. Thank you very much.
Hey, Joanne.
Yes, I know that when I changed from UMP to United 2 years ago, I found the tutorials on the HCA website very helpful. Are those still available?
They are still available, and we appreciate the plug.
They are really good. Marna.
Such a basic question, so I apologize, but the dental plans, the PEBB dental plans, are they also subject to the open enrollment period?
Yes, they are subject to the open enrollment period.
Okay, thanks.
You have to sign up at the same time. Yep. Good question. All right, Mary, unfortunately, I have to leave because I am going to attend a CMS webinar. So,
all right, you can't stay forever,
this.
Ellen. Thank you so much. You answered a lot of questions, and the
Appreciate
audience was great too. We just did, so you have the information. You will get the PowerPoint and the recording very soon, by Monday at the latest. And so you have an email address, and thank you so much for coming. And thank you, Ellen.
Thank
Great
you,
job,
Ellen.
everybody.
Thank you.
Take care.
Thanks, everyone.